Hi, I'm Mary. Caring for people with mental health struggles is a big deal, I know. Not only because I've had my own significant struggles in my life, but because I've had to support my family members going through their own experiences of turmoil too. I now work as a public school teacher specializing in social and emotional development, and I discovered such powerful frameworks and support systems. It wasn't always like this though. I remember the anguish. I've been there. I remember not knowing who to turn to, what options were available, who was a safe person to talk to, and who wasn't. And what I found was that I'm not alone, and there are rich resources and communities that can come alongside us. And I want you to know that too. If you're supporting people through their struggles, you're not alone. And there is vibrant hope for a future of beauty. The whole mental health system exists because so many people have these kinds of problems, like depression and extreme anxiety and substance abuse. 1 in 6 kids each year, actually. The San Diego Public Library cares. NAMI, the National Alliance on Mental Illness, cares. And this video is just one of the ways they show you that. In this video, I'm going to talk to you about mental health systems of cares in 2 main sections. I'm going to talk to you firstly about the children's mental health system, and then secondly, about how to get support yourself. The systems that are in place for mental health caregivers, including those who care for adults. As I talk, some of the resources I mentioned will pop up on the screen. As a support for you, you can download a free clickable PDF of all of those resources by going to mysdpl.org, Caregivers. This can serve as a good starting point for you as you connect to the rich support on your doorstep. It can be so powerful to connect to other people who have been through it. And although we're separated by a screen, I'm real. And there are countless others in our city who have navigated these situations. When I finally was able to connect to NAMI and parents, empowering parents, which have powerful networks and support groups, I managed to get answers to things that would have taken years to find out if I had tried to research it myself. Having a well-informed web of people who not only know what resources are out there, but have been through it themselves is one of the most enriching things. Because this journey is personal and individualized, but it's also shared. So thanks for being here today and sharing this journey with me. Let's start off talking about the children's mental health systems of care in San Diego. Growing up, I remember that experience myself, and it was full of emotion and confusion, but also wonder. Getting the support we need as we're finding ourselves and learn to understand our world can put the right foundations in place for a thriving life later. When our kids are struggling, that's hard for us, but there are all sorts of different services available depending on the extent of our children's conditions. In the children's mental health system section, we're going to explore things like developmental disabilities, the school system, therapists, psychiatrists, diagnosis, medication, teenagers, youth, and advocacy. But first, right here, near the beginning of the video, I want to let you know about the supports available in emergency situations, in case you need them urgently, if your child is a danger to themselves or others. First of all, It's good to know that you can always call the Access and Crisis line if you need someone trained to bounce ideas off of. They're super helpful. And through calling that number, there's the option of an awesome non-law enforcement team called the Mobile Crisis Response Team, or MCRT, who can come out and meet you where you are. The team has a therapist, case manager, and someone with lived experiences who have been through mental health crisis themselves. And if need be, like if your child is a danger to themselves or others, there are safe space hospitals for crisis situations. Another option is to have the psychiatric emergency response team officer come out to talk with your child in person by calling 911 or your local law enforcement agency and asking for a PERT officer to be sent. If they do think she's a danger to herself or others, then they will admit her to a hospital to take care of her. There are hospitals all over the county. Where you'll go will be dependent on your insurance. Some even offer partial hospitalizations, where kids can get the care of the doctors and all the therapeutic activities, but sleep at home. This is also similar to what's called intensive outpatient treatment, which is a short-term step down after a crisis and is an option for you. It's also good to know that there's an anonymous national crisis text line if you or your children need it. There are local emergency rooms, which are an option for you. And Rady's Children's Hospital emergency room is in Kearney Mesa, accepts all insurance and accepts you even if you don't have insurance. There's also an emergency screening unit for children that's open 24/7 in Hillcrest for people on Medi-Cal and who don't have insurance. They provide things like psychiatric evaluation, crisis stabilization, and outpatient counseling. They can connect you with case management to help manage all the necessary components, and they can provide emergency medication too. If need be, they can keep kids safe there for up to 24 hours. In an emergency situations, you're not alone. And there are highly trained and compassionate people here in San Diego to help restore harmony to your home. So with emergencies covered, let's move on to talk about other aspects of the children's mental health system of care, starting with developmental disabilities. If your kids have developmental delays or complications, then the regional center can provide a nice wide range of services and funding to support all aspects of their well-being. If kids have enough conditions that qualify as disabilities, then their caregivers can even get paid by in-home supportive services to provide care in their own home. There are also pathways that can lead to SSI benefits. One of the supports on the SSI pathway is the school's mental health system of care. So let's unpack. What's available to kids in their schools? Firstly, school counselors are available for students to go when they could use some support. School counselors can help with things like setting up designated places for kids to eat lunch and providing connections to other systems of care. If you're interested in getting your children connected with special education, there's an excellent app that NAMI has called Alfred and You. Check it out in the App Store. That lays out the process for you. Schools are required to provide a free, appropriate public education, which can include accommodations like listening to a recording instead of reading, using a calculator, having the lights adjusted, and having the timing of assignments changed. Our kids can also get things like technical support, aid services, counseling, and transport. You can ask for a Section 504 plan if your child's condition could be classified as a disability and to mental health condition counts. Or a more in-depth option is an individualized education plan, or IEP. You can arrange for an assessment for both of these things by calling your school district. The cool thing is that within the mental health systems, there's what's called the no wrong door policy. In that, any one of the systems you reach out to should be able to connect you to where you need to go without you hitting any dead ends. What I found is handy is having a 1 to 2 pager document that I can hand to providers that describes our child or loved one's condition, family history, symptoms, and things like that. It prevents me from having to tell the same stories over and over and keep my facts and dates accurate. So that's a quick synopsis of support from the school system. And mental health struggles can also be supported outside the school system, like through outpatient treatment with therapists and psychiatrists, which is set up based on your insurance. So let's go into that a bit. For private insurance, you would go through your provider and have good options, and your child's primary care physician could make referrals for you. You could go to Covered California to get insurance. If you've got Medi-Cal, or if you don't, you can apply by calling 211 if your income qualifies. Then it breaks it up into 2 different categories depending on the severity of the case. If the mental health symptoms are mild to moderate, then you can call your Medi-Cal managed care health plan. Provided you belong to, like Aetna or Blue Shield, there's 7 of them, and they'll get you connected to psychiatrists or therapists. If you have straight Medi-Cal, as in you don't have a plan, or there is a severity in mental health symptoms, for example, if your child has a mental health diagnosis or has attempted suicide or has been hospitalized in the last 6 months, then there's a particular list designed for these kind of services. And the link to the list is on the resource PDF. Let's talk about therapy. As well as calling your provider or using lists like I just described, another good option for finding a therapist is to check out Psychology Today's website, which has a therapist finder that you can add specific search filters to. It's good to find a therapist who clicks with your child and to be involved in the therapy process yourself. To be willing to educate yourself and to make adjustments to your home environment can make all the difference. In regards to that, there is an awesome free program called TBS, Therapeutic Behavioral Services, where someone would come out to meet with your child like once a week and teach them emotional coping skills and help you implement structure and supports around the house too. They can even go into the schools and support kids with their days sometimes, if that's where the behavioral issues are happening. Now let's explore psychiatrists, who are usually the ones to give your child a diagnosis and prescribe medication. Some parents have understandable concern and confusion about these things, like we did. So it's worth spending some time here, as there are a lot of nuances to it. One of the powerful things about getting a diagnosis for your child is that it can be the thing that qualifies them for services, and it can open your family up to a world of support. It's not that a diagnosis is necessarily a lifelong label, and it's not even essential to get the exact right diagnosis the first time. Diagnoses can be seen as useful categories that allow us to know what kind of things help other people who experience similar things to what your child is going through. But as with all of these things, it's a personal decision. Once you've got the diagnosis, it's up to each person to decide how to discuss that with their child. You know your family's system best and are the most well-informed about whether your child might play into the diagnosis or adopt it as part of their identity. Some people choose not to tell their kids what their diagnosis is. Others do. If you see your child having a level of maturity where they can understand the big picture in a way that you think is healthy for them, then telling them about their diagnosis can allow them to educate themselves, connect with other people who are also going through it, and understand themselves better too. I found that there's freedom in knowing that the diagnoses are nothing to be ashamed of, and that many of the most genius minds of all time have had these mental health conditions. And diagnoses are what allows children to potentially be prescribed medication. Medication is also a personal decision and a balancing act. It can sometimes be tricky to navigate the conflicting stories you hear from people. Some people may tell us, don't put your kids on medication because it's going to mess with their natural development. And then others take the opposite approach and say things like, well, if your child had diabetes, would you withhold insulin from them? Some people try the non-medical route first and find success there. But for others, it doesn't seem to work. For us, it really helped to bounce these ideas off a psychiatrist we could trust. And we actually shopped around a bit till we found one that really resonated with us. I've learned that trusting our instincts has been super helpful in this whole mental health journey. And as I supported my family member going through it, we came to the conclusion that we were going to try medication for a little while and see whether the competence and self-control it produced would increase their self-esteem and possibilities enough to warrant the medication, which we don't know all the implications of. But they are FDA approved, so there's some confidence in that. For some people, medications make the difference between misery and thriving, and they serve them well their whole life. And then for others, we found that medications can serve us well for a season, helping to bring about the focus and self-composure necessary to really engage with learning coping skills and life skills, which can then sometimes slowly replace the medication further down the line with our psychiatrist support. Medication can be a gift if it's handled well, but that's a personal choice, and there's no judgment. It helps to have a good supportive team, and we found it's important to be open with our doctor and to teach our kids to start to self-advocate and learn to describe their own symptoms. Like even little emotion charts can be good starting points to help our kids put their words to their feelings. It's also helpful for us to learn how to talk to kids about their mental health. Having words and conceptual frameworks can help them understand their inner life and serve them well as they're growing into thriving teens and adults. Let's transition to talk about mental health systems of care available to teenagers and youth. California is a state without institutions for children, and mental health is community-based. But if you have private insurance, there are live-in treatment centers that can be found on Psychology Today. There is also some group homes for teens, which are now called short-term residential therapeutic programs, and options for foster homes too. And there are also great programs to help with addiction and substance use as well, with links on the resource PDF. Then for the slightly longer term, there's a program called Oz, run by the YMCA, where youths aged 12 to 17 who are having a hard time can stay there for 2 to 3 weeks and learn living skills and problem resolution. And they get counseling and recreational activities. And after the program, they offer 8 family counseling sessions. Their payment is on a sliding scale. There are also opportunities for transitional aged youth, or TAY, who are from 16 to 25, as well as for Tay experiencing homelessness with links on their resource PDF. Like there's this one program where they learn to make and sell soap, which I think is cool. There are also online platforms designed particularly for teens. So there's a lot to offer, and the system can initially seem tricky, but it's like a living thing that we can actually change. You'll find that there is so much power in advocacy, speaking up and standing up and helping create a system that works for us all. The mental health system tries to be bottom up, designed to hear the voice of the people it serves. Like in the saying, nothing about us without us. And so you really can impact how the system operates. A great connection point for questions and direction, filing grievances, and joining councils is NAMI's CYFL, or Children, Youth, and Family Liaison. You're a hugely important part of the equation. Your family is a social ecosystem. And if you change one part, it changes the whole thing. And you have the power to change yourself, to nurture yourself so that you're in a healthy place, which can change the whole system. So let's move on to the next main section, caregiver and self-care resources. You're going to find that self-care is so important, not only for you, but for your loved one. I got 3 things I want to let you know about this section. Firstly, NAMI stages of emotional response to give us a roadmap of where you might be now and where you might be heading. Second, resources for caregivers, and not only for caregivers of young kids, but for people who care for adults who struggle with mental health too. And third, the way to empower and look after yourself. It was helpful for me to have an idea of what were normal human reactions when the plot for my family didn't go exactly the way I was hoping it would. NAMI has 3 stages of emotional response when life throws us these challenges and what we need in each stage. And it's helpful to bear in mind as we go through them, they're not necessarily linear. First is dealing with catastrophic events, and we can sometimes feel in shock or just normalize things, hoping it will go back to normal. In this stage, we need support, resources, crisis intervention, and empathy. Then in the second stage, learning to cope, these emotions from the grief process, like anger and guilt and resentment, can pop up. And it's helpful to know this is normal. In this stage, we need a way to vent our feelings while keeping the hope alive. We need education and support from the system. And then the third stage is moving into advocacy. Charge! And this is where the deep understanding and acceptance can kick in. And we realize we can change the system for the better, which benefits ourselves, our loved ones, and future generations. We need a restoration of balance and a responsiveness from the systems in this stage. There are a lot of resources available for caregivers. Knowledge is power. And as we explore resources, just know that there are all sorts of free and affordable ways to gain this power. There are NAMI family-to-family classes, parenting classes you can access by calling 211, and the supportive advice and a listening ear you can get from calling the Access and Crisis Line. With adults, a lot of people with mental health conditions have what's called anosognosia, where they don't feel like they need help, even though you know they really do. There's such thing as Laura's Law, or court-mandated treatment for adults, but there are very specific criteria for that. There's also a wonderful program that can serve as a gateway to Laura's Law cases, as well as other supports called IHOT, the In-Home Outreach Team, who serves so-called treatment-resistant adults by meeting them wherever they're at. They have a wraparound team of peer support specialists, case managers, therapists, and family support partners. And what the family support partner will tell you is what I'll leave you with. One of the most important things is looking after yourself. You know, it's like they say on the airplanes, you've got to put your own oxygen mask first before you can help others put theirs on. Because if you pass out and you're no good to yourself or anyone else, NAMI has some tips for us that I'll share. What I've found works for me, and a lot of people find works for them, is taking some time for yourself every day, even if it's only 10 minutes. You may want to use that time to exercise. I've discovered that exercise can be a game changer. Even just 5 to 15 minutes dissolves my stress, gets my heart beating, and revitalizes me, while at the same time allowing me to relax and sleep deeper later on. And sleep is such a huge component in our wellness. Sometimes it can be hard for us to turn our minds off. What I found is that I have to play the long game and know when it's time to stop checking things off my to-do list, start winding down. And I've also learned to be more discerning about what I say yes and no to. I've realized it's important to cut myself some slack, to know that no one is perfect, and all I can do is make the best decision with the information I have now. Trying to consciously live in the present moment has been liberating for me. And you know what I've been enjoying? I'll reward myself fairly regularly. Just treat myself to spirit-lifting things, because when my tank is full, that tends to overflow into my world and those around me. And when I'm empty, everything is hard. It's hard to get from A to B when your car is out of gas. So I personally need to fill up my biopsychosocial spiritual tank a little every day. And one of the biggest things that fills my tank is connecting with other people who get it and who have gone through it. And I have learned it can be really liberating to learn that it's okay to ask for help. You're not alone. You're a part of this incredible human story, and yours is linked to so many of those around you in our magnificent city. Our city cares about your mental health and the mental health of those you care for. I care. The library cares. NAMI cares. Thank you for spending this time with us today, and may the rest of your life be the best of your life.